Hello! In this tutorial video, we will be covering strokes in some detail. We will talk about the types of stroke, symptoms, treatments. First, we begin with some brain anatomy. Here we see the brain in inferior view. The frontal lobe is involved in planning and organization, as well as many higher cognitive functions like behavior and emotions. Posteriorly is the temporal lobe, which is important in visual memories, comprehension, and emotional association. The pons is part of the brainstem, between the medulla oblongata and midbrain. It contains nuclei involved with movement, sleep, respiration, and facial expressions. The medulla is located in the hindbrain, regulating circulation and respiration. Finally, the cerebellum is a structure with two hemispheres behind the medulla and pons. It's involved in fine movement, coordination, memory, and cognitive function. So, what are strokes? It's a seriously life-threatening medical condition in which the blood supply to the brain is cut off. Therefore, the brain cells don't receive enough oxygen, resulting in brain damage and possibly death. Now we will talk about the circle of Willis. The brain requires a constant supply of oxygen and nutrients provided by the blood in order to function correctly. But if the blood is restricted or stopped, the brain cells begin to die. The major blood supply through the brain is by the circle of Willis, which is an anastomotic system of arteries that sit at the base of the brain. It's formed when the internal carotid artery enters the cranial cavity bilaterally and divides into the anterior cerebral artery and middle cerebral artery. The anterior cerebral arteries are then united by an anterior communicating artery. These connections form the anterior half of the circle of Willis. Posteriorly, the basilar artery, formed by the left and right vertebral arteries, branches into a left and right posterior cerebral artery, forming the posterior circulation. The posterior communicating arteries complete the circle of Willis by joining the internal carotid system anteriorly via the posterior communicating arteries. Here we will talk about the types of strokes. There are two main types of strokes, ischemic and hemorrhagic. Ischemic strokes are the most common type, affecting approximately 85% of patients. It's caused by blood clots, also known as thrombus, or by fatty material, atheroma, blocking an artery, restricting the blood flow. In atherosclerosis, cholesterol plaques are deposited within the walls of the arteries, narrowing the inside diameter, therefore increasing blood pressure. The plaque deposits cause blood cells to build up and form clots. This usually occurs on large blood vessels of the neck and base of the brain. Hemorrhagic strokes, on the other hand, are less common, affecting around 17% of patients. This happens when the wall of a blood vessel in the brain becomes weak and bursts, causing bleeding and damage. And now we will talk about the symptoms of stroke. Some of the symptoms of stroke are weakness experienced as dizziness or wobbly knees. Sometimes, patients can also experience nausea and vomiting. They may also experience loss and blurring of vision, especially in one eye. It's also common to have headaches and loss of consciousness caused by non-sufficient oxygen in the brain. Finally, we will discuss the treatments of stroke. Currently, there are two commonly used treatments for both ischemic and hemorrhagic stroke. Ischemic strokes can be treated using a tissue plasminogen activator, also known as TPA. It dissolves the clot and improves blood flow to the affected areas. It can also be treated by endovascular procedures, such as a mechanical thrombectomy to remove the clot by a stent retriever, which is a wired cage device. Hemorrhagic strokes can be treated through surgery to prevent bleeding after rupture. And endovascular procedures can be performed through a catheter which is placed into a large artery and leads to aneurysms where the agent is released to prevent rupture. We hope this was a helpful video. Thank you for watching.